Hello, my name is Meera Bhatt, and I'm a junior at Montgomery High School in New Jersey. Welcome back to the interview series on colleges and careers, where I talk to established professionals from a wide range of careers to learn and gain a well-rounded understanding about different careers and different pathways to success. Today, I'm super excited to be speaking with Dr. Kripa Nambiar, a primary care physician who has been in practice since 2004. She completed her MBBS from Calcutta Medical School in Kerala, India, and continued residency at Southside Hospital, affiliated with Stony Brook University in New York. For the past 16 years, she has served as a community physician and hospitalist at Robert Wood Johnson University Hospital and St. Peter's University Hospital in New Brunswick, New Jersey. Currently, she works in the outpatient and nursing home setting and also provides services at Princeton House Behavioral Health Hospital. I'm super excited to be speaking with you, Dr. Nambiar. Welcome. So, Dr. Nambiar, I just wanted to start by asking you, how did you decide you wanted to go into this career as a physician?
Okay, well, I trained in India, right? So in India, the decision is made for you. That's how it is. Like, if you do reasonably well in high school, you get to write an entrance exam, and then you kind of like become either a doctor, a lawyer, or an engineer. So I always wanted to be in medical field, just because, again, it kind of like interested me. So I chose that just because, again, I happened to kind of like not do so bad in my entrance exams to kind of get into med school. So after joining, I kind of like really started enjoying, digging it. So to be quite frank, I didn't really kind of like have another choice, especially in the 90s back in India, you don't have much other options, other fields to explore. So it was just kind of like a genetic decision or an inherited decision for me. Yeah.
Right. Well, I guess that in some ways makes it easy, like right now we have so many options.
Yes, it does. Again, it's a hit or miss. In my case, it became a hit, that's all. Yeah.
Yeah. So to bounce off of that, what education is necessary to do what you do as a decision now? I know we hear a lot about like direct 7-year programs, at least in the US. And could you just go into a little bit about what you did, and do you recommend that?
Yes, actually, I don't know how much, as I said, would my career pathway is going to help you guys in high school, because I came from India. I kind of like joined here after I finished my med school in India. Okay. So when I came here, what I did was I had to write a couple of exams that the medical school kids here have already taken to kind of have my degree qualified here. Okay. So I had to kind of like do an English exam first to kind of make sure that I do know what I'm talking about, and then have a USMLE step 1. It's called US Medical Licensing Exam step 1 and step 2 and step 3. Write that, and then write what's called a clinical skill assessment, where you actually kind of are given mock patients and mock situations and see how you're doing with those. And then you have to kind of like qualify, kind of pass all that, and then your degree gets qualified. Then you kind of like join the rest of US medical students to kind of like go into a national matching program. And you kind of like choose your field. Either it could be family medicine, internal medicine, pediatrics, dermatology, whatever it is, surgery, whatever it is, you can do that. Out here, yes, you do have a 7-year program, and you do have a 10-year program, like where you kind of like go finish your med school, your undergrad, and then you kind of like apply for MCAT, and then you kind of get into med school. Right. So 7 years, again, that's offered by various schools around. Again, you're kind of like required to do very well in certain exams out there, and then kind of like they kind of like look at your CV, your academia, your biodata, basically, and then kind of like have some rigorous interviewing process to make sure that you are qualified to go into 7-year program. So it's a bit different, and I'm not very sure about how to kind of go about that, because I've never done that here, but that's what I hear.
Well, thank you for sharing your experience. It's intriguing to hear about all the different options and how, people can take so many different paths and end up in the same spot.
Right. Yeah.
So now, as you're practicing as a physician, what does a typical day or week look like for you?
Yes. Again, it can be very very varied. For me, again, depending upon which day, I can start as early as 6 a.m. or as late as 8:30 a.m. And then kind of go on into either around 5:30, 6 o'clock. I could be in the office setting, kind of like seeing scheduled patients, or I could be in a nursing home, seeing patients that I kind of like admit and take care of, or I could be at Princeton House where I see psychiatric inpatients. So it's just, again, walking around seeing patients, depending upon which day I am, where I'm at. Yeah. Okay. I don't go to hospitals. I don't do hospital rounds. So it's a little less hectic that way. So that's one good thing about being a doctor. You can choose how busy or how not busy you want to kind of be. You can choose your own schedule and kind of like work from there. Yes.
Wow. Yeah, that's interesting. I think that a lot of people like think about when choosing a career, like what will my day-to-day look like? So to hear that, you have whatever schedule you do, which is maybe a little bit more relaxed than the next person.
Yeah. Yes, you can work part-time, you can work full-time, you can work in the hospital, you can work in outpatient setting. You can, once you kind of like get your degree, it's up to you. What do you want to do?
Right.
You can be your own boss or you can work under someone. It's all up to you.
Yeah. So given your experience, what type of people do you think are suited for this profession? Do they need certain skills or a certain personality type?
Well, you have to be a people's person. That's outright there, because again, you are dealing with humans day in and day out. Mm-hmm. And you're going to be having a lot of people, different walks of life, especially, people who are not going to be all that happy because they're coming to you sick. So they're going to be kind of like a little frustrated, a little kind of like emotional coming to see you. So you have to be you have to be a good listener. You have to have great empathy, and you have to kind of like know how and be a good communicator, so to speak. And obviously, if you're all that, I think you can go places.
Right. Well, I never thought about it that way, and how doctors only most of the time see us at kind of our worst. So that's an interesting perspective.
Yeah, absolutely. Yeah.
So what do you like and not like about working in this job?
See, the best thing I like about it is I get to meet a lot of people. I get to kind of like form a lot of like lasting relationships. Mm-hmm. I get to, because I work in the primary care setting, I know a family, all the family members, right, from the baby to the grandpa. I know everyone in that family, and I get to know them on a first name basis, and I get to know what's kind of happening in each family. And they kind of like treat me as a family member too, which is actually very interesting and very kind of like endearing. Mm-hmm. So that is the most important or the most fun aspect of the job. And again, as with many jobs, yes, this can kind of like get a little frustrating, because yes, you do have like certain long hours, and you can sometimes kind of miss certain, birthdays or anniversaries or like, vacation plans and all that. That's all there. Mm-hmm. And that sometimes kind of like gives you a momentary frustration, which almost always passes. Otherwise, I won't be able to keep doing this. Right. So, and again, you look at any other job, it's going to be the same thing. Every job has its ups and downs, and so does this job. But in the end, it does kind of like cater to your inner need, that you are able to kind of like, that you're helping someone, and that you're making a little bit of difference, even if it's a tiny bit in someone's life.
Right. It's wonderful.
That day is worth it. Yes.
Yeah, it's wonderful to hear about that, like a relationship, like you mentioned, that you can form with your patients. Yeah. So kind of to bounce off of that, what interests do you have that this job fulfills? Some people that I've just talked to about their profession, they were really into science or history, and then they decided to go into a career with that, and they're continuously able to learn. So what about you?
See, as you know, medicine is an ever evolving field. Yeah, I mean a field. You never stop learning. Mm-hmm. There's always new techniques kind of like being developed, or new kind of medications coming out, or new scientific study being kind of like conducted, and all geared to kind of help people. So if you are, as you know, if you don't have your health, or if you're not healthy, I mean, health is wealth, right? So if you don't have your health, that's going to be really kind of like cause a negative impact on the whole society as it goes. So I'm actually kind of like getting that kind of satisfaction working in this field, that again I get to do something that can help the mankind, or human mankind, to the best. So and again, being a people's person, I kind of like get that feel like I get to talk to everyone. I don't have to kind of talk to a machine, or I can kind of like see people, kind of like hear their stories, and kind of like maybe kind of get inspired by that. So that part of my life is being kind of like taken care of there in my field. Yeah.
That's really interesting to hear about. So for people who are thinking that they want to become physicians in the future, or entering the field of healthcare, what advice would you have to offer them?
Well, first of all, you have to understand there's going to be some long hours. Med school is not going to be easy, but having said that, if you kind of put your mind to it, it's really exciting, and it can be really rewarding. You have to kind of give up planning ahead. You have to kind of like make sure that you may have to kind of like probably kind of like you may have to be on call. You may have to kind of like be somewhere where you can't be. So you have to kind of like be prepared for that. Be prepared to kind of like work long hours. Be prepared to kind of like stay away from home. Be prepared to kind of like have backup and all that. But see, the good thing is, like, once you finish your training, you decide how much you want to work. You can be the boss of like, okay, I don't want to, because again, if you kind of enter into any other field, there's going to be set hours that you have to kind of like be on call or be working. But here you can be the boss of, well, heck, how much you want to work. So you can be as busy as you want to be. And so there's this kind of like general idea that, okay, being a doctor, your life is kind of like all ruined. You're going to be working all long hours. You don't have a life apart from working. But no, that's not true. You can actually kind of like just balance your work life and home life beautifully with this job. And there's no retirement. You can work as long as you want.
Right. So that's refreshing to hear that, you know, you can, in spite of what we hear about this profession, there's another side to it.
Yes, absolutely. Yes.
So given your experience, what is the scope of this profession or status of this industry for the future? Where, I mean, like you mentioned, health is wealth, and we're always going to need doctors. But do you think that given technology and AI being of more influence in our lives, your profession will still stay in the same manner that it is as of now?
It may not stay in the same manner, but absolutely, yes, doctors are indispensable. Now, with the pandemic ever so, we've seen that we're going to be kind of looking into more like global medicine.
Right.
You know, you can be in one part of the world and you can still kind of take care of your patients wherever they go to, with the boom of telemedicine now. I can say that I have had many of my patients who were actually in Boston, in California, in Texas, that I still took care of via telemedicine. Now, obviously, yes, the physical examination part and all that is still lacking, but still, yes. So global medicine is going to be one way. And again, yes, as you rightfully mentioned, AI, robotic surgery, and distant robotic surgery is definitely going to be playing a lot in future. But for everything, you need to kind of have a doctor. So definitely computers or technology cannot replace doctors. So doctors are still going to be around, and it's going to be a little bit more and more, as I said, more globalized rather than more localized.
Right. And through my interviews, I've heard a lot about this globalization of not just healthcare, but so many other fields, because through the pandemic, we saw the value of how, you know, people from around the world can come together to truly, you know, work in a more positive manner. So that's wonderful to hear. So to move on to the next part, I wanted to ask, if you had to go through the whole career college admissions process or anything of that sort all over again, would you do anything differently given what you know now?
Actually, no. I think I want to kind of like a family physician all over again, because I have to say, even though I do have my moments of frustration with, as I said, with any other job, you can have that. This has been really rewarding for me. Mm-hmm. And I have kind of like kind of grown as a person, doing what I've been doing. I've learned a lot, and in learning a lot, I have like taught a lot also. Right. So I think I would not do anything differently, even though I kind of like stumbled upon this career. Mm-hmm. As an by accident. I think this is it for me. This is definitely going to be my advice. Like for me, this has kind of worked out perfectly. Yeah.
That's really exciting to hear that you know, it worked out so positively for you, and that you really enjoy what you do. So like I mentioned just a little bit about AI earlier, from your perspective, do you think that there's any exciting or emerging fields or industries given how like our world is changing? I've heard a lot about like AI, public health, big data through my interviews, all things, especially in the pandemic, that we saw an increase of.
Yes, as I said, global medicine, again, people now, surgeons are actually kind of like conducting surgeries with robots remotely. You know, you have like rural areas where you don't have surgery. Mm-hmm.
Yeah.
Where you not just in US kind of like see this, you can actually see doctors from here kind of helping like remote villages in India. You can have like doctors kind of like extend their help. You can actually see how much of research has gone into vaccination. Like right now, you can have like seen vaccinations kind of happening, like research kind of like booming there. How this pandemic has actually been controlled by this, the research that's been put into it. So yeah, it's when you talk about medicine, it's not just again being a doctor. You can actually go into various fields, like where you can actually do research, research about say vaccines, new medications, cancer treatment, treatment for muscular dystrophy. There are so many other areas where you can actually kind of like prove your skill. So yes, there's a lot more to medicine than just being a doctor.
It's really valuable to hear about the different areas that you can go into if you're interested in this field. So to close out our interview today, I just wanted to ask you if you had any last advice for, you know, high school or college age students who are interested in becoming a physician or just in the healthcare field in general.
So yes, basically, if you really kind of like enjoy helping others, enjoy kind of like being with people, and enjoy biology, so to speak, there is nothing that should be holding you back. You would be, and again, there are so many areas to kind of choose from when you kind of like enter the field. You can actually kind of like, if you can go to the research aspect, you can go to the biotechnology aspect of it, or you can actually become a traditional doctor. It's just that you have to kind of like understand that there is going to be a lot of like hours to put in initially when you kind of like are in school. That's something that you have to expect, and I don't want you to kind of like be overwhelmed by that and say, okay, I cannot do this, because I've had some students who just kind of like go into it and then see that there's a lot to study or a lot to kind of like hours to kind of like give, and they feel like this is going to be my life. I don't want to do this. No, this is certainly doable. And again, another kind of complaint I've heard, so to speak, is like, okay, I have to kind of like put my 10 years of study into med school, and by the time I come out, all my friends are maybe earning, or they're kind of like well settled in their fields. But look at it this way, you are having a profession that's going to kind of like last with you for your lifetime. And you can be the boss of who you are, like you can be your own boss. You can choose your hours, and yes, you tend to kind of like earn pretty reasonably well if you kind of like do your job pretty diligently and you're kind of like well liked. Yes, you will be able to kind of like make a good living of it. And just imagine the scores of hundreds of people that you would be able to kind of help and have that respected position in the society too. So I think if you are a people's person, if you're really kind of like interested in kind of like dealing with people, this is one field that you don't want to kind of like miss out on.
Right. Well, I've never thought about some of those things. So thank you so much for sharing your perspective with me and all the others who will watch this video. Thank you for all your work during the pandemic. And yeah, thank you so much for being here. I really
My pleasure, Meera. My pleasure.
Thank you.
Take care and all the best in your future endeavors.
Thank you.